Good morning, everyone. Our topic is all about the enterprise diagnostic medical imaging modalities. So, before we proceed to our discussion, here are the members of this group: Cheryl Evangelista, KL Balbutan, Lord Zaira Bagilat, Zenia Ferramos, Mario Dalayday, and yours truly. Enterprise diagnostic medical imaging modalities. In a clinical setting, medical imaging modalities are a vital contribution to the overall diagnosis of the patient and help in the decision of an overall treatment plan. Therefore, in the spectrum of a broad range of imaging modalities are the specialties of nuclear medicine, positron emission tomography, magnetic resonance imaging, and ultrasound. Overall, imaging for medical radiation purposes involves a team of radiologists, radiographers, and medical physicists.
So the first imaging modality, which is the X-ray scan, is to be discussed by Zenia and Mario.
X-ray scanner. An X-ray scanner, also called radiography, it is a diagnostic imaging technique that produces image of bone, providing clear detail of the bony structure. Some other imaging techniques also use X-ray to show the bone in even greater detail, such as CT scan, but they are also more expensive and involve more radiation exposure. X-ray use safe amount of radiation to create picture. The image help healthcare providing diagnose a wide range of condition and plan treatment. Discovery of X-ray. Wilhelm Conrad Roentgen, a German physicist, discovered X-ray on November 8, 1895. He termed these rays as X-ray after mathematical symbol for the unknown, X, which were ultimately called Roentgen rays. First radiographed the human body. Bertha Roentgen Hunt. Our exposure time 15 minutes. Four major components of X-ray scanner. First, the X-ray tube. Second, the operating console or control console. Third, the high voltage section. Fourth, the film holder, grid cabinet, or table. The X-ray tube. The X-ray tube is a device for generating X-ray by accelerating electrons to high energies and causing them to strike a metal target from which the X-ray are emitted. Major component of X-ray tube. We have cathode, anode, and glass envelope. Cathode. Cathode is a metallic electrode through which current flow out in a polarized electrical device. We have two components of cathode: filament and focusing cap. Filament is a source of electron. It is a coil of tungsten wire about 2 mm in diameter and length. Focusing cap, negatively charged shallow depression on the surface of the cathode of an X-ray tube, which concentrate the electron beam towards the focal spot of the anode. Anode. The anode is a positively charged electrode. The anode attracts electrons or ions. The anode may be a source of positive charge or an electron acceptor. We have two types of anode: the stationary or fixed anode and rotating anode. The stationary or fixed anode X-ray tube are used in dental X-ray imaging system, portable imaging machine, and other special purpose machine in which high tube current and voltage are not required. General purpose X-ray tube use the rotating anode because they must be capable of producing high intensity X-ray beam in a short time. Glass envelope. A glass envelope lies within the tube housing. It surrounds the other component of the X-ray tube, including the anode and cathode. The primary function of glass envelope are to provide support and electrical insulation for the anode and cathode assemblies and to maintain a vacuum in the tube.
Number 2, operating console. The operating console allows the radiologic technology to control the X-ray tube current and voltage so that the useful X-ray beam is of proper quantity and quality. And it provides for control of line compensation, KVP, MA, and exposure time. And radiation quantity is usually expressed in milliroentgens or MR or milliampere seconds or MAS. And radiation quantity also refers to the number of X-rays or the intensity of the X-ray beam. And it consists of an on or off control, and it controls to select KVP, MA, and time or MAS. Number 3, high voltage section. A device that transforms electrical energy from the potential supplied by the X-ray control to the tube operating potential. The device may also include means for transforming alternating current to direct current, filament transformers for the X-ray tube, high voltage switches, electrical protective devices, and other appropriate elements. It is responsible for increasing the output voltage from the autotransformer to the kVp necessary for an X-ray production. On high voltage generator, some heat is generated in the high voltage section. Also, it consists of three primary sections. First is high voltage step-up transformer, and the second is filament transformer, and last is rectifiers or diodes. And all components immersed in oil. Number 4 is radiographic table or film holder. It is a patient support device with its patient support structure or tabletop interposed between the patient and the image receptor during radiograph and or fluoroscopy. Regardless of the type of X-ray imaging system used, a patient supporting examination couch is required. And radiographic table makes imaging unstable or handicapped patients safer. The table is designed to support the patient in a position that enhances the radiographic examinations. It must be uniform in thickness and as transparent to X-ray as possible. The carbon fiber couches are strong and it absorbs little X radiation. This is used to contribute to reduce patient radiation dose. Next is, how does an X-ray machine work? So X-ray machine work as an X-ray beam passes through your body and the body tissues and bones it absorb or block the beam in varying amounts depending on its density. And it also creates a shadow that is picked up on film or a sensor placed on the opposite side of the beam, much like when you hold a flashlight up to your hand and cast a shadow on a wall. Next is, are there any risks? So X-ray use a small amount of radiation to create image of your body. And the level of radiation exposure is considered safe for most adults, but not for a developing baby. If you're pregnant or believe you could be pregnant, tell your doctor before you have an X-ray. They may suggest a different image method such as an MRI. If you ingest a contrast material before your X-ray, it may cause side effects. This includes hives, itching, nausea, lightheadedness, and a metallic taste in your mouth.
So next, we have the CT scan to be discussed by Sai.
Computed tomography scanner. It is also known as computerized axial tomography. A CT scan is a diagnostic imaging procedure that uses a combination of X-rays and computer technology to produce images of the inside of the body. It shows detailed images of any part of the body, including the bones, muscles, fat, organs, and blood vessels. In the working principle of CT scan, when X-rays are irradiated on the human body, Some of the rays are absorbed and some pass through the body to produce an image. In plain X-ray imaging, the film directly absorbs penetrated X-rays. In CT scanning, an electronic device called a detector array absorbs the penetrated X-rays, measures the X-ray amount, and transmits the data to a computer system. A sophisticated computer system, in turn, calculates and analyzes data from each detector in each level, and finally reconstructs multiple two-dimensional and cross-sectional images. History of CT scan. In the early of 1900s, Alessandro Vallebona proposed a method to represent a single slice of body on radiographic film. This method was known as tomography. The first commercially viable CT scanner was invented by Sir Godfrey Hounsfield in Hayes at EMI Central Research Laboratories using X-rays. Hounsfield conceived his idea in 1967. It was publicly announced in 1972. So, um, that is the prototype CT scanner. So let's move on to the main components of a CT scanner. We have the gun tree, data acquisition system, and operating console. The first component is gun tree. The gun tree is the largest of these systems. It is consists of X-ray tube, collimator, patient table, and detector. So sa X-ray tube, it is consists of anode and cathode. Compensating filters are used to reduce the radiation dose to patients and help to minimize image artifacts. And sa collimator naman, pre and post are present, reduce scattered radiations that reaches to detector array. And sa patient table, patient lies on the couch and move through gantry aperture during examination, made of carbon fibers to prevent it from interfering with X-rays. So next, we have the data acquisition system. It refers to a method by which the patient is systematically scanned by the X-ray tube and detectors to collect enough information for image reconstruction. The data acquisition system consists of the following parts: the detector, current to voltage converter, preamplifier, analog integrator, analog to digital converter, and computer. So how data acquisition system works? Yung X-ray photons come on the detector. The detector detects the intensity in form of current. So the current is converted into voltage. The analog integrator removes spikes. The analog signal is converted into digital form, and this signal can now be processed and reconstructed in the computer. So by the way, we have two types of detectors, the gas field and scintillation detectors. So under gas field, the sensitive phase is 100% and the detection efficiency 45%, while the scintillation detector sensitive phase is 50% and detection efficiency is 90%. Since 90% of 50 is 45, the output is same. The overall efficiency of both the detectors is same. In the image reconstruction, after enough transmission measurements, it is sent to the computer for processing. A software called Fourier Slice Transform is used. More than 250,000 reconstruction algorithms are used to compute the image. The last component is the operating console. It is the MAS controller of the CT scanner. It is used to input all the factors related to taking a scan. So typically, this console is made up of a computer, a keyboard, and multiple monitors. Often there are two different control consoles, one used by the CT scanner operator and the other used by the physician. The operator's console controls such variables as the thickness of the image tissue slice, mechanical movement of the patient couch, and other radiographic technique factors. Application of CT. A CT scan has many uses, but it's particularly well suited for diagnosing diseases and evaluating injuries. The imaging technique can help your doctor to diagnose infections, muscle disorders, and bone fractures. It is also to pinpoint the location of masses and tumors, including cancer, to study the blood vessels and other internal structures, assess the extent of internal injuries and internal bleeding, guide procedures such as surgeries and biopsies, and lastly, to monitor the effectiveness of treatments for certain medical conditions, including cancer and heart disease. Are there any risks? CT scans use X rays, which produce ionizing radiation. Research shows that this kind of radiation may damage your DNA and lead to cancer, but the risk is still very small. Your chances of developing fatal cancer because of a CT scan are about 1 in 2,000. But radiation's effects adds up over your lifetime, so your risk increases with every CT scan you get. Talk to your doctor about the procedure's potential dangers and benefits, and ask why the CT scan is necessary. Since its introduction in the 1970s, CT has become an important tool in medical imaging to supplement X-rays and medical ultrasonography. Although a number of institutions offer full body scans for the general population, this practice remains controversial due to its lack of proven benefit, cost, and radiation exposure.
So we are now on MRI to be discussed by Cheryl.
Doctors find, watch, and treat medical problems. MRI uses very strong magnets, radio waves, and a computer to produce images of the body structures. Human body is mainly composed of fat and water, which makes the human body composed of about 63% hydrogen. History. The first MRI image was published in 1973. The first studies performed on humans were published in 1997, created by Dr. Raymond V. Damadian, Dr. Larry Minkoff, and Dr. Michael Goldsmith in 2003. 2003 Nobel Prize in Physiology or Medicine was awarded to Paul C. Lauterbur and Peter Mansfield. Made new MRI imaging techniques faster and more efficient. Components: a magnet that produces a very powerful uniform magnetic field. Gradient magnets are much lower in strength. RF coils to transmit in radio frequency. A very powerful computer system translate the signals transmitted by the magnet. The most important component of the MRI scanner is what we call magnet. The magnets currently used in scanners today are in the 0.5 T or Tesla to 0.2 to 2.0 T range, or 5,000 to 20,000 Gauss. Higher values are used for research up to 9 Tesla, while Earth's magnetic field is 0.5 Gauss. Gradient magnet. This magnet has a much lower magnetic field and is used to create a variable field. So, next is the RF coils, transmission of radio frequency. RF coils are needed to transmit and receive radio frequency waves used in MRI scanners, volumes, and surfaces coils. There are two types of coils: head coils for the head and knee coil for the knees. Principle of MRI is spinning atoms face outside the magnetic field. Next one is the energy absorption by RF coils. The resonance of hydrogen atoms is measured by an RF antenna, and the received signal is sinusoidal in shape. Imaging by the computer, which receives mathematical data, which is converted through the use of Fourier transform into an image. How does an MRI work? First, put the subject in the big magnetic field, and next is transmit radio waves into subject. Receive radio waves that have been transmitted by the subject. Store the data and repeat this step. Next is the process raw data to reconstruct the images and getting high-resolution images. When placed in a large magnetic field, hydrogen atoms have a strong tendency to align in the direction of the magnetic field. And lastly, inside the bore of the scanner, the magnetic field runs down the center of the tube in which the patient is placed, so the hydrogen protons will line up in either the direction of the feet or the head. The majority will cancel each other, but the net number of protons is sufficient to produce an image. So this is the image processing diagram of the MRI system. MRI pictures are more detailed than the other methods. MRI may find bleeding in the brain changes, problem with your back, and injury inside the body. Are there any risk using MRI? Before MRI, kailangang matanggal ang metal objects dahil hindi safe ang MRI sa mga patient na may medical implants. And MRI scanners are very noisy, kaya gagamit ang patient ng earplugs or headphones. Sa tulong ng una ng straps, helps the patient stay in a correct position. May mga closed scanners and open scanners. Open scanners is yung open sa isang side niya. The technologies will be operated on the next room. Patient and the technologies can communicate each other through a speaker. When the radio waves turns off, scanners pick up energy signals from the body. Energy signals is used to make pictures. Patient should stay very still para mas maayos at clear yung images. Patient may be asked to hold breath for a short time or a while. MRI may take 30 to 45 minutes or longer to complete. May mga ginagamit to make a clear pictures, which is what we call the contrast dye. After MRI, the patient can resume the normal activities. Technologies let the patient drink plenty of water or healthy drinks to help kidneys remove the contrast dye from a patient.
So the next is ultrasound, to be discussed by Lord Zaira.
Ultrasound is also used to guide procedures such as needle biopsies, in which needles remove cells from the abnormal area for laboratory testing.
History. In 1794, Lazzaro Spallanzani analyzed the basic mechanisms of the navigation of flying bats in the dark. In 1880, Galton created and produced apparatus that was able to produce sound waves of a frequency of 40 Hz. In 1912, Paul Langevin, a French physicist, and colleagues to research the use of high-frequency sound waves to find German submarines. In 1928, C. Sokolov, a Soviet physicist, first proposed the idea of ultrasound to find flaws deep in metal structures. In 1947 to 1948, Karl Dosik, an Austrian physician, and his brother Friedrich, a physicist, introduced hyperphonography, and in 1956, Ian Donald introduced the ultrasound in Diagnostic and Medicine. Why an ultrasound is performed. Most people associate ultrasound scans with pregnancy. These scans can provide an expectant mother with the first view of her unborn child. However, the test has many other uses.
External ultrasound. The sonographer puts a lubricating gel into the patient's skin and places a transducer over the lubricated skin. The transducer is moved over the part of the body that needs to be examined. Examples include ultrasound examination of a patient's heart or a fetus in the uterus. The patient should not feel discomfort or pain. They will just feel the transducer over the skin. During pregnancy, there may be slight discomfort because of the full bladder. Internal ultrasound. If the internal reproductive organs or urinary system need to be evaluated, the transducer may be placed in the rectum for a man or in the vagina for a woman. To evaluate some parts of the digestive system, for example, the esophagus, the chest, lymph nodes, or the stomach, an endoscope may be used. A light and an ultrasound device are attached to the end of the endoscope, which is inserted into the patient's body, usually through the mouth. Before the procedure, patients are given medication to reduce any pain. Internal ultrasound scans are less comfortable than external ones, and there is a slight risk of internal bleeding. Ultrasound transducers. The transducer or one is normally placed on the surface of the patient's body, but some kinds are placed internally. This can provide clearer, more informative images. Examples are an endovaginal transducer for use in the vagina. A spatial transducer is gently inserted into the vagina to look at the uterus and ovaries. A endovaginal transducer is sometimes called a pelvic ultrasound because it evaluates structures inside your pelvic or hip bones. An endorectal transducer for use in the rectum. The test creates images of the prostate by placing a spatial transducer into the rectum. A transesophageal transducer passed down the patient's throat for use in the esophagus. A transducer inserted into the esophagus obtains heart images. It's usually done while under the sedation.
We have also the endorectal. Endorectal ultrasound is a medical test to find tumors in the rectum. If a cancerous tumor is found, the test will provide information on the size, location, and how deeply the tumor is growing into the rectal wall. Lymph nodes close to the tumor will also be checked to see if the cancer has spread.
Ultrasound is also used to guide procedures such as needle biopsies, in which needles remove cells from the abnormal area for laboratory testing. Image the breast and guide the biopsy of breast cancer. To diagnose a variety of heart conditions including valve problems and congestive heart failure, and to assess damage after a heart attack. Ultrasound of the heart is commonly called an echocardiogram or echo for short. An ultrasound scan can reveal whether a lump is a tumor. This could be cancerous or fluid-filled cyst.
So, are there any risks? Standard diagnostic ultrasound has no known harmful effects on humans. So, last we have the nuclear medicine to be discussed by KL.
Also known as nuclear imaging, radionuclide imaging, and nuclear scans. It helps doctors find tumors and see how much cancer has spread in the body. A nuclear medicine scan uses small amounts of radiations to create pictures of tissues, bones, and organs inside the body. In addition, nuclear medicine is a specialized area of radiology that uses very small amounts of radioactive materials or radiopharmaceuticals to examine organ function and structure. History of nuclear medicine. In 1930s, discovery of artificial isotopes, notably iodine-131, uses to diagnose and treat various diseases associated with the human thyroid, and the TC99M, which is technetium 99M, as a hepatobiliary imaging agent. First treatment in 1939 with phosphorus 32 and iodine 131 in 1946. 1950 and 1960 is the thyroid imaging. Gamma camera and rectilinear scanner in 1950s. In planar imaging, the gamma camera remains stationary. The resulting imaging are two-dimensional. Single photon emission computed tomography, or SPECT, produces actual slices of the organ in question because the gamma camera rotates around the patient. These slices are similar to those performed by a CT scan. In certain instances, such as PET scans, three-dimensional images can be performed using the SPECT data. First is PET scan, an imaging test that can help reveal the metabolic or biochemical function of your tissues and organs. Second, bone scans. A bone scan is a test that uses nuclear imaging that helps diagnose and track several types of bone disease. Nuclear imaging involves using small amounts of radioactive substances, radio tracers, a special camera that can detect the radioactivity, and a computer to see structures such as bones inside the body. These are used to evaluate any degenerative or arthritic changes in the joints, to find bone diseases and tumors, and to determine the cause of bone pain or inflammation. The third one is the thyroid scan. A thyroid scan is a specialized imaging procedure for examining your thyroid, the gland that controls your metabolism. It's located in front part of your neck. Typically, the scan works with nuclear medicine to evaluate the way your thyroid functions. Thyroid scans thus are used to evaluate thyroid function or to better evaluate a thyroid nodule or mass. The last one is the gallium scans. These are used to diagnose active infectious and inflammatory diseases, tumors, and abscesses. Gallium scan is a type of nuclear scan that can find cancer, infection, or inflammation in the body. A radiologist injects a small amount of radioactive substance into the bloodstream. The gallium settles in areas of the body where there is inflammation or infection. Are there any risks? Nuclear medicine scans are generally safe and have been around in some form for about 50 years. The radiation dose that you get is usually very low and doesn't pose serious health risks. Some people have an allergic reaction to the tracer material, but it's usually mild and doesn't last very long. It is important to tell your doctor if you're pregnant or breastfeeding because they may need to take certain safety precaution or change the timing and type of scan. As stated above, nuclear medicine scans may be performed on many organs and tissues of the body. Each type of scan employs certain technology, radionuclides, and procedures.
Thank you for listening. Stay safe and God bless.